Hello friends, I am Dr. Maithili Hazarika, an Associate Professor of Clinical Psychology from Guwahati Medical College Hospital. At the very outset, I would like to thank the Health and Family Welfare Department, Government of Assam, for taking this initiative to form an Assam Mental Health Task Force. This task force is going to address the mental health issues of the people in need in this crisis of COVID-19 pandemic. We are going to address the mental health issues of the people who are in quarantine, in isolation, in self-quarantine, and all the people who are in distress due to this COVID-19 pandemic. Thank you very much.
Hello friends, welcome to the webinar series on telecounseling training for the counselors. At the very outset, I would like to acknowledge the Health and Family Welfare Department, Government of Assam, for giving us this opportunity to initiate an Assam Mental Health Task Force to deal with the matters of mental health for the population in distress during the COVID-19 pandemic. I, along with my team, will be giving a series of lectures through webinar on different issues like telepsychology, basic guidelines, crisis management, pandemic-related issues, management of stress, depression, substance abuse, and various other issues through webinar as lecture format for academic purpose only. I am Dr. Maithili Hazarika, an Associate Professor of Clinical Psychology from the Department of Psychiatry, Guwahati Medical College. I am involved in different kind of organizations in the state. The disclaimer that I would like to say is that these discussions generated during the presentations are academic in nature and they are not the laws or they are not the substitutes for any kind of professional legal opinion. For any legal opinion, please contact the advocate or a lawyer. Now, what is counseling? Counseling is a scientific technique of dealing with the matters of interpersonal relationships, conflicts, and to develop one's personality through dialogue and discussion, which could be face-to-face, verbal, non-verbal, with text, and via different kind of communication like the telephone and also video conferencing. Telepsychological counseling during coronavirus disease, that is 2019 pandemic, is defined as the delivery of psychological services using information and technology, such as telephone, text, and video. Now we will address the need of the people only via telephone, and if required, we are going to introduce tele-video conferencing also. Where are we now? The telepsychological counseling team starts responding to the distress in any phase of the disaster. At this point of time, we are in the operational phase because we are already taking calls from the people who are in distress. The counselors should be highly trained in counseling in pandemic. But in a pandemic of this nature, basic training is required with some kind of training of how to deal with different issues in hand with the help of certain kind of guidance, guidelines, and training process. The most important thing in communication is hearing what is not said. So it is a challenge for all of us to know and address the issues of the mind and heart only over the telephone. Why is it important? Telepsychological counseling at this point of time is safe because we will be infected from patients who have COVID. Otherwise, we are also in lockdown. So it is better to deal with people over the telephone. It is advanced in technology and can be reached across boundaries and across ages. Physical violence against the doctors is less here because people cannot reach us physically. The teleconsultation also gives a lot of freedom and enables the doctor to use his or her discretion to stop the counseling process due to some valid or compelling reason. Why is training important? Training of the trainers is very important because the crisis helplines are emotionally very, very demanding and may bring burnout in us. The ability to handle stress reactions such as anxiety, depression, and some kind of issues of the body like headache, body ache, tingling sensation, which could be related to the COVID. That is, after the epidemic or the pandemic, people had developed all these issues, then we need to handle them. And there could be grief and loss issues, that people whose own family members are dead due to the virus, or there could be some other underlying issues of death and dying. So we need to know how to address that under some kind of supervision. The competence of a counselor is that a counselor should ensure that they are skilled and competent, and they should also know the potential impact that their communication will have upon the callers. They should possess the basic essential requirement, that is a knowledge of psychology and counseling. They must also know how to deal with the issues of the mind, like the affect, the emotions, the thought, and also the behavior of different people, which may change due to stress. The minimum qualification which is required is Masters in Psychology and Social Sciences with in-depth knowledge in telepsychological counseling. But in this case, we are screening only those people who are getting trained by us and to help the people in need, because we don't have volunteers who are all trained in psychology or have some kind of degree of that sort. So volunteers will be screened, and accordingly they would be given activities for psychological care for the distressed population. Who can initiate? Anybody can initiate to start counseling from the caller's perspective. Anybody can call us. Caregivers can also call us. These caregivers are basically a friend or a relative or a family member who is representing the caller, or they could be parents of a minor. The minor could be in distress, and he or she could ask his parents to call us. And there could be health workers. Health workers also could call us, like the nurse, the health professionals of different levels, to registered counselor. And sometimes a registered counselor also needs to call the counselor for their own issues, how to handle anxiety, and there could be burnout, and there could be other issues to discuss. So they could also call up the counselors. How to address them, what terminologies to be used to the callers. So we can use terms like client, user, or caller to refer to the callers who call us for in helplines. The process of teleconsultation is only through telephone, not to be anywhere, anybody, for any other purpose. The consultation cannot be anonymous. That is, you have to give your own identity, where you belong from, which I'm going to talk in ethical and other guidance through the series. Both parties should know about each other's identity. If one party, that is the caller, doesn't want to, we have to note it down. Maybe it is confidential and some other issues could be there. So you have to note it down that the caller did not identify himself as him, what he is, from where his background is. He has not. There could be a reason for that. It is client-centered. We are going to give more importance to the caller's problems. Ensure confidentiality. We are going to talk about confidentiality later again. Same guidelines have to be followed what we follow in in-person therapy or in-person counseling. Detailed assessment has to be taken by the interview method only. The counselor's requisites are, they have to be soft-spoken, good communication skills should be there, the local language is desirable, the responder should know what is empathetic listening and non-judgmental attitude. They should give support and reassure the callers that they are of some help to them. They should be informed about the facts and myths about COVID-19, because a lot of myth may make them panic. There should be non-discriminatory interaction. There should be full respect for the callers, and there should not be any political and religious issues to be discussed. When to call or receive calls. The helpline will be operational 24 hours and shift duties will be given to the team members. Automated call routing will be preferable to ensure that immediate help is provided according to the availability of the counselors in each zone. Callers are encouraged to be comfortable with any kind of callers, so we need to make them understand that. Callers, if they are given some designated numbers, they have to call accordingly and how the team proposes for them. Thank you very much. Now, this is about a flowchart. This flowchart is about a client calling you, then the counselor receives the call. At this point of time, it is via telephone. Then if there are other medical factors, then we have to give the referral. There could be multiple psychological factors. Then we have to take the consent. If you are using it for some research purposes or for some other purposes, then consent has to be taken and explicit consent should be ensured. Assessment has to be done, not formal assessment, but some kind of tool that we have developed that we are going to talk about in the next series. Then we have to identify what are the problems and then manage them with different kind of management skills that a counselor should employ. Then the resources and the helpline numbers has to be there, and if required, telemedicine if it is required, then we have to refer to the mental health professionals, that is a psychiatrist, to give the medicines. So this is the entire flow chart. Then you have to follow, all of us need to follow this flow chart while dealing with the cases. Thank you. This is the basic practice-based practice guidelines that we have developed, and all of you need to read these guidelines before starting with telepsychological counseling for the people in distress. I'm going to talk about ethical issues after this.
Hello friends. Today I'm going to talk to you about the ethical standards of care for the counselors who have come forward to address the mental health issues during this COVID-19 pandemic. What are ethical standards or legal standards? Ethical standards are based on the human principles of right and wrong, whereas legal standards are those standards that are set forth in government laws. Legal standards are based on written law, while ethical standards are based on human rights and wrongs. The helpline team should be sensitized to certain limits of involvement as well as obligations about maintenance of confidentiality and meeting the callers privately or not. So these are given in the ethics. So meeting callers privately for any other reasons or exchanging personal information is prohibited. Discussing calls with relatives and friends should not be done, and it should be avoided at all times. Telling callers to follow any specific religious practice or political issue should be avoided. The ethical and professional standards to be met by the counselors are identical to those of in-person counseling sessions. Counselors must make adequate effort to ensure that ethics and professional standards of care and practice are met from the very outset and throughout the duration of the telepsychological counseling. Confidentiality needs to be ensured. What is confidentiality? Confidentiality refers to the principle that the content of sessions, data, or information is not available or disclosed to any unauthorized persons or processes. It can be breached if there are safety issues, if there are issues that a person is wanting to harm himself or harm other person, then confidentiality can be breached. What is boundary violation? Boundaries between the caller and the counselor needs to be maintained at all times. The counselor is not to meet the client in person anywhere for any other purpose besides in-person therapy. If you want to switch over to in-person therapy when the lockdown is over and things become normal, then you can definitely switch on to a in-person setting. But till then, there should not be any meeting for any other personal reasons. The counselor should also avoid disclosing any private personal information to the caller and not to discuss about the content of psychology to the telepsychological calls to any friends, relatives, or any other person except the treating team or the supervisor. What is anonymity? A consultation is not to be anonymous. That is, both the parties must know each other's identity. But if for some reason the caller refuses to give his or her identity, please note it down but proceed with the call and check whether there is any confidential issues of not declaring his name or her name. Conformity to these ethics of helpline duties is a must, and any breach can result in legal actions. What is informed consent? Any caller initiating the contact for counseling services through telephone, text, videos, and in person shall be considered as implied consent. Means any caller calling you defines that it is a consent for the telephone counseling. So you do not have to take another kind of informed consent from them that you are going to start with telepsychological counseling. However, they have to be notified with explicit content when their calls would be recorded for any kind of clinical or research purposes. Counselors must make reasonable effort to safeguard and maintain the confidentiality of the patient's information, but also should inform them of the possibility of risks to loss of confidentiality inherent in the telecommunication technologies. Explicit consent would be either audio, video, or text message. The format will be followed. I'm going to show you the format, how you have to take the consent for any other clinical or research purposes. No formal testing is suggested aside from rating their stress, anxiety, and depression in a questionnaire prepared by the authors to provide a preliminary assessment of the psychological status, which will be provided to you. Unique mental health related issues may be revealed erroneously if formal tests are administered without adherence to basic guidelines. So formal testing must be avoided during the process of telepsychological counseling. The assessment is to be based on this scale. Like you need to ask them, do you have any anxious thought? Are you fearful for any reason? Are you feeling panic as if an impending doom, somebody is trying to grab you, that kind of a feeling, and you feel breathless? Are you suffering from any kind of worries or preoccupied with any kind of issues that is harming yourself and interfering your day-to-day life? Any tension? If the person says yes, then you have to make her or him elaborate upon that. And you can also ask, do you feel low, sad, tearful? Are you crying? Do you feel there is no meaning in life? There is no hope? Do you feel you're helpless? There is nobody to help you out? Do you feel guilty? For the quarantine and isolated people, they might feel they have done something wrong. So by getting the disease from somebody or being a suspect of the disease. So you need to probe into the guilt feeling, because that leads to depression, and that might also lead to suicide attempts. So all these, if it's yes, you need to probe more and more into detail. And then you have to ask about death wish and suicidal thoughts. That is very important, because if they say yes, then they should be considered, or those cases should be considered as emergency. You have to ask whether the sleep is disturbed or not. Any kind of early insomnia, that he cannot sleep in the initial part of the night, or gets up in the middle of the night and tosses and turns on the bed, or gets up late and feels very tired. Any kind of sleep disturbances needs to be noted, and you need to elaborate on that by asking more questions. You can also ask the person in a 0 to 10 rating scale, where do you rate your stress level? If he says 9 and 10, then probably you have to do some kind of stress relaxation techniques needs to be told to them, which would be given in one of the modules. You can go through those modules to know about how to de-stress yourself, how to do what kind of relaxation you have to practice, some kind of deep breathing exercises or cognitive restructuring. You need to replace negative thoughts by positive thoughts. So all these are important to ask. So based on this kind of investigations, you can do some kind of therapeutic work. This is the informed consent form. You have to write the name of yours from the department that you belong to or any institute that you belong to. And then I hereby provide my informed consent for video, audio, text for psychological counseling and written record of my data for research purpose. By returning this form, I indicate consent for these telephonic sessions. This could be given by WhatsApp or any other media of communication. And if they return back, that means they have given the consent for you to record and to keep for research purposes their data. So you need to adhere to all these ethical guidelines that is provided to you, and at all times do not breach any of the standards that are set in these basic guidelines that we have made and published.
Welcome to the third topic in the webinar series. It is on telecounseling for quarantined and isolated people. The person details. You need to take the details of the person who is quarantined or are isolated. They should be taken from the officials who would provide you with all the details about the name, age, gender, and prepare it very well before talking to the person concerned. Introduce yourself as I am so and so. I am a psychiatrist or a social worker or a psychologist currently working in this and that and calling on behalf of the Health and Family Welfare Department, Government of Assam. That is very important to say. Then say, is it a good time to speak or can you spare a few minutes with me? If the person says yes, proceed to the next. If he says no, ask if you can call back at another mutually agreed upon time. Note down the response, and if they do not reply, end the conversation then and there, and then get back to them again the next day or next allotted time given to you. The language. You have to know the language that the person is most comfortable with, and then further proceed. If you do not know the language, then maybe that you have to designate some other counselor immediately. If he doesn't understand your language as well as you do not understand his language, then the communication cannot take place and counseling will not be taking place then. Listen. Please start with an open-ended question like, how are you today? Are there any stress? Are there any concerns or issues that are bothering you? Allow them to talk, to ventilate about their concerns for the next minute or two. Hear them out. They may shout at you, they may use a lot of abusive language, or they may become very, very silent, indicating that the counseling is functioning, because these are the signs of counseling and they are ventilating their problems. Always remember that the person in quarantine may not be nice to you, so you have to deal accordingly and accept, because their status is not what we are feeling and thinking right now. They are in a much deplorable condition because they are suspects of the COVID-19. So they will be having a lot of stress. So that stress may make them very angry, upset, and they may shout at you. Educate about facts. Keep your data ready. Look for authenticated information from government websites and mainstream government-run media. Generally provide them with available facts about matters of quarantine, what is happening, what are the different measures that are being taken, and validate their emotions that their concerns are very common and lots of individuals are facing the same issues that they are facing right now. Reassure. Provide reassurance to their problems and do follow-up calls when required. Assure them of your help and support, which is available 24/7. Reiterate the emergency contact numbers. Appreciate. It is very important to give a lot of positive reinforcement to them. Appreciate their efforts in undertaking what they are doing right now. Reinforce the fact that the clients are actually contributing to the society and the family and their loved ones by isolating themselves or keeping themselves in quarantine. Use appropriately worded questions in respective languages and mark yes of the assessment tool that I had already provided in my last webinar. Please go through those. This was the one which I had given. I'm not going to explain in this series because I had already explained in the second series. Open-ended question. Ask them open-ended questions on how they are spending time. Address their concerns and then provide with specific tips like exercise, doing some indoor exercises like spot jogging, push-ups, yoga, breathing exercises, mindfulness-based kind of stress reduction techniques that they can download from the YouTube. They can read some books, listen to some music, and also they can download different kind of movies that they would like to see. They can ring up their family members from the bed, from the same place that is provided to them. And they should avoid excessive social media and also about the myths that is going on about COVID-19. They should take help of only government media and reliable sources of information that you need to provide to them, and they should avoid daytime naps, otherwise it will be very difficult for them to sleep at night. Contact details has to be given to them about any kind of non-psychological concerns that they have, and facts and myths should be disintegrated. That is, myths should be told and clarified to them and facts should be given to them. Helpline numbers are 100, 181, 1070, 1077, 1079. Those should be provided to them for any kind of other issues. The resources of support could be from all these different kind of websites of Ministry of Health and Family Welfare, Government of India, Indian Council of Medical Research, and also different kind of coronavirus related public health information websites. If telemedicine is required, which is permitted in India from 25th March 2020 by the Ministry of Health and Finance or Family Affairs, if the psychiatrist is a counselor, then he or she should prescribe the required medicine by following the telemedicine guidelines immediately if it is required for the client. When possible, attempt to elicit information about already prescribed medication or why if the caller had stopped taking prescribed medication. It is useful to redirect the caller back to their doctor for follow-up visits regarding their medication. Warn them not to use or misuse the psychiatric medication without consultation or without prescription from a registered practitioner. The counselor should exercise his professional judgment to make a decision on the suitability of telemedicine or face-to-face consultation bearing the particular client's interest in mind. If face-to-face counseling will be required, then you have to immediately report to the supervisor talking about it and they can arrange something about it. The format to collect information is this. First, name of the volunteer. What is your name? Field of specialization. You belong to psychology, psychiatry, any other profession. Date, time and duration of your session. Source of information. Where did he hear about this helpline? Name of the contact person. It is important to write it, but if it doesn't say the name, then it is not mandatory. You can skip. Age, sex, marital status, education, occupation, and place that he belongs to. What is the status of the person who called you? Is he the person who is distressed or somebody else? History of physical illness or any kind of medical illness, any psychiatric illness which was happening, and any medication used for that. Purpose of the call, why he has called, what is the intervention technique that you had used, and what is the outcome of that technique. You have to do follow up and ask for feedback. Was he satisfied with your call? He needed something else. So you can mark it in a 1.5 rating scale also. If 5 out of 5, then you have done a very good job. If 1 or 2, then you have to ask what more is required from the call. So in that way, you can collect the data in this format that is provided to you here, and write it down or download this format accordingly. Thank you very much. And this is the best practice guidelines that you can go through to understand in a stepwise manner how you have to go for doing the counseling. Hello friends, welcome to the telepsychological counseling for anybody in distress. Now coming back to stress or distress. What is stress? It is a feeling of emotional or physical tension. It is the body's reaction to some demand, which is a challenge, which are not possible to deal with the coping resources that we have. It can come from any event or any kind of thought which makes us feel frustrated, angry, or nervous. And if stress lasts for a long time, it may be very harmful for our physical, mental well-being. When people experience traumatic and often unexpected events, their first reaction is usually a combination of fear and distress. Stressful events activate the body's fight or flight response, unleashing adrenaline and stress hormones like cortisol. Almost everyone exposed to a natural disaster will experience some of these immediate biological and psychological effects. After a disaster, your entire routine in life is disrupted. Many people are unable to return to work. Some lack the strong support system that they have, which is happening in the lockdown period in COVID-19. And there is added financial burden. We can see what kind of a burden that is happening on different kind of people during this pandemic. The low-income population, the major stress, because the daily wage earners, the migrant workers are having a lot of stress. The elderly people, because of the physical illnesses, they are kept aside and also in quarantine. And the women who are, if quarantined, then they are in major stress because they would not be able to cater to the needs of their children. And if children are also very vulnerable to mental health issues during this COVID-19. To the strategies of telepsychological counseling has to be thoroughly understood in order to provide mental health care and support, because these strategies are going to define whether you're doing a good work or not during the distress. So first you have to ascertain the client's age, the culture, the socioeconomic status, education and employment that the client belongs to. So you have to ascertain all those during the phase of counseling. It's not that when the counselor calls you, immediately you're going to ask, okay, what's your age? What kind of a background you belong to? Not like that. In the process of counseling, you need to elicit this information. Clarify if the decision to call the helpline is for his own concern or for somebody else, that is on behalf of the family member, friend, or who. If a client appoints a guardian to call you on his or her behalf, then you have to ascertain that. Approach should be client-centered, and first response is very, very important to establish a deeper contact with the caller. The responder must be soft-spoken and must have very good communication skills. Local language is always preferred, and find out which language the person is comfortable with and do counseling with that language. If you do not know that language, then you have to switch over to some other counselor who knows that language, or take help from the supervisor about what to do in such cases. But you cannot continue with counseling if you do not know the language. The type of communication and words must be coherent, that the person should understand what you're speaking, and you should also understand what the person is speaking. So it has to be very clear and goal directed. You have to have a goal in doing the sessions. The responder must also be non-judgmental. You should not judge anything as good or bad, right or wrong. You must be caring, genuine in your approach, respectful, accepting, and empathetic. You should understand from the client's point of view what he is saying, not from your point of view. You should understand where he is coming from. So the background is very important for that. And be very, very genuine, because the client will understand whether you're doing the task just as a duty or you are genuinely concerned with the person in distress. Provide active listening and respond to the caller in a very calm and controlled manner. I have some case vignettes which I'm going to explain to you later. Take note of the tone and pitch of his voice, which is very important, as the client cannot be seen in person. So all these stress levels and other kind of depressive effect is based on the client's voice, pitch, and tone. In video calls, it is different, but this telephone, it is different. So you have to give a lot of importance to the tone, his way of talking, the style of communication. A detailed assessment has to be taken through this interview process. The counselor must record the client's concerns in the format that I had already provided and said about in my last presentation. And there should be non-discriminatory interaction, no political and religious or secular topics or conversation. It is healthier to empathetically reply to a caller and explore his or her past coping mechanisms. That is, if there was a stress in his life, how did he cope? Did he approach the conflict? Did he avoid it? What resources that he used? Did he take help of his friends? Did he go to a counselor? You need to ascertain all those in order to give him good suggestions. Slow emotions down. That is, do in here and now issues that are concrete and reality oriented. Counsel about reinforcing the focus, that is what is happening now. Make them aware of what is happening in and around them. Be sensitive, ask them to connect to people and use effective intervention to get engaged in daily activities and hobbies. And you can speak about that also, creative ideas, innovative kind of explore what is in their mind and what strategies you can ask them to employ. Define the matter by analyzing the antecedent behavior and consequences. What led to the situation? What happened for which the client was very angry? If it talks about an anger situation, so talk about what led to this situation and what did he do in that situation, and try to give some kind of advice and suggestion to deal with the matter differently next time if it happens. Repeat if you do not understand. It is difficult to clarify over telephone or any other methods of technological communication. So use some feeling words like, are you happy, sad, distressed, are you fearful? All those kind of feeling words should be given in order to inquire about their mental status. Keep a notepad to document the foremost important information. Be very sensitive to the underlying emotional content and reflect upon the feeling in words. During tele-video counseling, the etiquette should be followed similar to in-person consultation. That is, formal dress, how you talk should be formal, and the boundaries needs to be very clear in face-to-face as well as telecommunication. Always begin with open-ended questions like, what are your activities now? How do you wish to define your feelings? Can you define your present status well? If safety is an issue, then you have to revert to close-ended. Do not use open-ended then. You have to ask very direct question like, who is there with you? Are you sad? Are you feeling suicidal? Are you feeling lonely? Is there someone with you? Are you with someone who is abusing you? Or you are finding it difficult to tell me? If it is so, please say, what is the time now? This is a code language. If somebody is abusing someone and you're asking, is somebody abusing you? He may not be able to tell you. So use a code language like, if somebody is abusing you, tell me, what is the time now? Then you will understand that this is a code that she or he is saying about somebody abusing him or her. Then you have to do some kind of emergency intervention to help the client from the abuser. Make alternatives in an exceedingly stepwise manner. Generate options with the client's help and ask to try and do according to the plans discussed and committed by the client. Always let the client verbalize what is discussed and planned to ensure that both the counselor and the client are in complete agreement. Obtain commitment to the plan discussed. It is always helpful to build a straightforward, specific, and time-limited plan of action. Do not make it very vague. Make it very specific. This and that he has to do at this particular time for these days. So make it very straightforward, and both of you, the counselor as well as the caller, should agree upon the plan and do accordingly. If the counselor encounters a situation in which the caller is too distraught or distressed to communicate anything clearly, then you have to use some kind of grounding and breathing exercises or relaxation exercises, which I'm going to explain in one of my presentation, how you have to deal with people who are in distress, who is crying, sobbing, not being able to tell you anything. Then you have to do certain things over the phone, direct him some suggestions, calm him down, make him relaxed, and then ask him what has led to the situation or what is he feeling now. So this is the way you have to do counseling for a person who calls you up for any kind of distress.
Hello friends, let me talk about tele-counseling for emergency and problem callers today. What are red flags? Red flags are situations of emergency. When do we call it an emergency? When one is harmful to self and others. Any kind of or even expression of self-injurious behavior is to be taken seriously. If there is any mention of getting very angry with others to the extent of killing the other person, then that person has to be under 24/7 vigilance, and support system of the caregiver has to be there, and we have to ensure that they are not alone and in a protected environment. Signs of immediate help. There could be indication of low mood. They may say that I want to die or contemplating for suicide. Always remember that asking about suicidality does not increase the risk of suicide. It is a myth that asking about suicide increases the risk. Actually, it decreases the risk. So what you need to do is empathize with that person first, then try to understand and create a rapport so that the person listens to what you're saying and tries to do the same. And also the therapeutic alliance is very, very important. Whether the person, you could establish any kind of a alliance with that person so that he could be calmed down and he could be assured that we will help him. And then let us talk about a girl during the lockdown who had called me. She was very depressed and she was stressed. She had obsessive compulsive disorder and also hypertension with a single dad from a middle class family. This is a history that I had taken, and she had no siblings. So sometimes we need to go back and ask their family situations, what kind of a family she belongs to, who is there in her family, to understand and to give her that kind of a help and support. So she says, I feel miserable, and at times I want to die. These thoughts come and go, but when I think more, I feel it's better to die. There is no hope. This is an emergency, so has to be treated very seriously. Then immediate referral to a psychiatrist or for hospitalization needs to be ensured. Then another boy from the village called up under lockdown, very stressed. He is the sole financial earning member of the family from the village, and he had to take care of his siblings, and he had a mentally challenged mother also. So his situation was very, very deplorable, and he had no money to even feed his siblings. He told me, I have nothing to look forward, and as if the world has come to an end. I want to do a lot, but don't know how. So though he mentions about hopelessness here, but still he says he wants to do work. So here it is not an emergency situation, but to keep him by the family member in a protected environment so that he do not lose hope and do not do anything which is seriously harmful for him. Firstly, you have to calm him down, ask him to drink some water, make him sit down, take slow breaths, practice mindfulness that, we focus here and now, what is happening at this point of time, rather than what will happen in the future, what has happened in the past. Count from 100 to 1 or 10 to 1 to ask him to just calm down and distract himself from his thoughts. Think about your parents, focus on the good. Think about your mother who is mentally challenged. You have to be with her. You need to also take care of your health. So count the blessings that you have, that you can provide so much for this family, for your family, express the gratitude. So all those different kind of mechanisms that we do in therapy needs to be told to him to make him understand that he is of value to the family. But he has to be kept under vigilance because he said that I have nothing to look forward. But you can also suggest that he has to go to a mental health professional, a psychiatrist, because he could be in a depressed framework. So he might need medicine. So these are the certain situations your clinical judgment has to be applied to help the person in distress. So problem callers. What are problem callers? There are two kinds of problem callers. One are disturbed callers and one are abusive callers. So what to do? You have to first identify, is this a caller who is trying to disturb you unnecessarily with no intention of getting some help from you? So then you have to set limits, set boundaries, and you have to relinquish the control mechanism that he is wanting to assert on you by saying different things that please help me, I'm having this problem, and it goes on and on, but you don't understand what is his problem. So it is like he is trying to control you by wasting a lot of your time. Never allow any caller to waste your time. Never allow the caller to manipulate or control you. So the strategies that you can employ for disturbed callers are: use open-ended inquiries, like refocus the conversation back to the caller by asking, what did you hope to gain from calling this telephone, which is meant for psychological care only? If refocusing does not work, then set limits by saying, we both can discuss your situation for 5 minutes exactly, as there are many clients who are wanting my help. Then if he doesn't understand that, if his inappropriate behavior still persists, then terminate the session after 5 minutes. Strategies for abusive callers. It is advisable to interrupt an abusive caller. Inform the caller that you are ending the call and invite him or her to call back when his or her form of communication is more acceptable by you and respectful. If you are having a particular difficult time with a caller and another counselor is available, it is appropriate to inform the caller that you are transferring the call to someone who will be better able to assist him. So these are the different ways that you have to deal with the situation. But if you're very stressed out and you do not know how to handle, then take the help of your supervisor. But do not abuse, do not be angry, do not lose your own control, because your patience is very, very important in order to deal with such kind of emergency situation, because these are situations that stresses us out. So emergency situation and problem callers and abusive callers, you need to develop certain techniques to deal with them. I hope it helps, and also look at the practice guidelines.
Welcome to the telecounseling webinar. This is about how to deal with counselor stress. We all are stressed. The counselors are also humans. We get stressed by the calls, by the things that are happening around us. So we need to identify the different kind of symptoms of stress within us. If we have some kind of somatic symptoms like headache, backache, body ache, and we are very extremely tired, if we are anxious, we have panic attacks, we are irritable, getting angry and frustrated very soon. If we are becoming very hostile to people around us, we are isolating ourselves, withdrawing and crying, and also using a lot of substance abuse like alcohol, cigarette, or any other kind of substances. Or we are confused. We don't know how to think clearly, totally blurred. Our judgment is not right. If our memory is sinking, we are having difficulty in thinking about things straight. And we are having insomnia. We are not sleeping well. Our appetite is decreased. Libido is decreased, altered bowel and urinary habits. And we have different kind of symptoms which are difficult to understand. Then we are stressed. In these kind of matters and these kind of conditions, we definitely have to seek help from other supervisors, counselors, therapies we have to take, and also may have to go for medicines. So realize your own stressors first before trying to help other people. So in order to identify, if you have identified all these symptoms of stress, then take a break. Take a break till you again can motivate yourself to deal with the calls of the callers. If taking a break doesn't help, it is advisable to seek advice from colleagues and supervisors. Always use headphones with microphones, as long-term use of handheld telephones can be very painful and detrimental to your health. It is important not to dwell on issues which are problematic to the next caller. That means if somebody had abused you and was very angry with you and the counseling process did not go well, then do not take that memory to the next caller, because displacement may happen and you may ruin your counseling session with the next caller with whom nothing was happening negative, but subsequently you will feel much more stressed out for that. And if you feel angry for any reason, then end the consultation then and there, but give a valid reason for doing that and say that you're going to fix another counselor with that person. Calls from severely disturbed individuals may be very upsetting. So after ending such phone calls, debrief yourself with a coworker or a supervisor. You need to ensure support for your own well-being. So debriefing always helps. You need to brief about what had happened, how did you do, what kind of sessions you had taken, share your concerns and share certain things which you are upset and you do not know how to tackle about. As crisis helplines are emotionally demanding and can potentially result in burnout, it is important that young counselors have access to adequate mentoring and supervision. For relaxation, you need to exercise daily, do deep breathing exercises or any kind of relaxation exercises. We will have some webinar series for stress reduction, anger reduction. So from there also you can learn a lot. Maintain all the access to all the helplines like police station, administration numbers, and collect the helplines from neighboring states also for referral in case it is needed.
Namaskar, myself J.N. Tulika, and today I'll show you a few asanas and pranayamas which you can do on your regular basis in your home. So for that, we're sitting Dandasan, we'll do Paschimottanasana. Inhale slowly and gently, lift your both hands up. Exhale, release your lower back. Try to hold your big toes. Exhale, completely go down. Be there for a while. Inhale and exhale for a few rounds. Then look up. Inhale, come up. Stretch your both hands up. Exhale, down. Now next we will do Ustrasana. For that, sit in Vajrasana. Slowly and gently come up. Keep gap in between of your knees. Inhale, slowly and gently. Hold your right heel. Exhale, hold your left heel. Now completely expand your chest, release your head back, inhale and exhale here for a few rounds. To come up, inhale slowly and gently, hold your right face, then your left and then sit down. Up next is Bhujangasana. For that, lie down on your abdomen. Bring your legs together, toes together, palm by the side of your chest, elbow close to each other, chin on the ground. Inhale, come up half the way. Be there with few rounds of inhalation and exhalation. Now slowly and gently come down. And next is Setu Bandhasana or bridge pose. For that, bend your knees, keep your palms by the side of your heels. Inhale, lift your hips up as much as possible. Let your chin touch your chest. Inhale, exhale here for a few rounds. Then slowly and gently drop your hips and relax here for a few seconds. After that, we will do two pranayam. One is Kapalabhati. In Kapalabhati, we will focus mainly on the exhalation part. As well, we will flap the abdomen. For that, like this. In this way, we will try to do for 20 to 60 strokes per minute. Okay. Next is Nadi Shodhan Pranayam or Anulom Vilom. For that, you can take your right hand or right palm, then keep your right thumb over the right nostril. First exhale through left nostril. Then inhale through your left nostril. Close your left nostril. Exhale through your right. Inhale through your right. Close your right nostril. Exhale through your left. So continue this practice for 9 to 21 rounds. So complete this cycle and then relax. Hope this asanas and pranayama will help you to keep away from diseases and keep your immune system strong. Thank you.
Deal with the problems with a positive mind and always be less stressed and relaxed and calm while doing counseling. Otherwise, counseling is never going to help if you are distressed. Hello friends, welcome. Today I'm going to talk about the practical approaches in telepsychological counseling during COVID-19 pandemic by the counselors who are working as volunteers for delivering psychological care and services to all the people who are in distress. I'm going to talk about certain case studies here in a very, very practical manner. Let me discuss about case number 1. These are certain cases that I had dealt with, and from those cases, I have taken out 2 cases as in order to give you some idea about how the counseling needs to be done. You know, what are the things that you have to talk about, probably what do you mean by different strategies that I had told about to having a counselor. So this is a distress call number 1. The caller speaks like this. Let's go over how the person spoke and how probably I had responded to her or him. So this is about Rita. I am Miss Rita. I need your help. Is it mental health helpline? You, the counselor. Yes, it is. And I am Dr. Maithili Hazarika from the Health and Family Welfare Government of Assam. Please tell me, what help do you require from us? The caller. I am feeling very low, as if my future is dark. As my entrance exam was due, and the lockdown had created a lot of conflicts in my mind, and she starts sobbing. Sobs, keeps crying uncontrollably, and then appeared to have difficulties in breathing. She could not speak any further. Then the counselor, that is you, please calm down and start concentrating on your breathing. I will start counting from 1 to 10 and you breathe in till I ask you to breathe out. Please sit down comfortably. Did you sit comfortably? And that person has to say yes. Remove your slippers or shoes. Tap your toes on the ground. Relax. Now I see that you're breathing slowly and deeply. Now please go to the kitchen and have a glass of water. Take the sips of water slowly. Try to calm down. Focus only on your breathing in and breathing out. Now that you are calm and rested, tell me what exactly happened. In the above example, the counselor took time to establish the psychological contact with Rita in the first instance itself. By leading her into a series of grounding exercises like doing this, doing that, sit down, remove your shoes, take a deep breath. These are the grounding exercises. The caller was stabilized and she was refocused to her problems and take up from there to some kind of problem solving. Caller. The lockdown is creating difficulties to move around. So when I had a fight with my boyfriend yesterday, he called me to say that he no longer wants to continue this relationship. So once a breakup, I was stressed. I was shocked to hear this, and I feared to share this with my parents, as they are having their own trouble for finance and other issues. I have no one to talk to, and I feel completely hopeless. Sometimes I feel I'm better off dead. You, the counselor. Okay? So you said that you're bothered and extremely stressed about your exams, your career, and you had a breakdown for some reasons. And at the same time, your parents are in trouble, so you don't feel like sharing your issues. And at the same time, you're feeling lonely, hopeless, and have death wish too. Am I correct? This is active listening, and the counselor is reflecting what she had said. I hope you can understand what I mean by active listening, by reflecting in your own words about what the caller had told her or him. Caller, absolutely. Now she agrees that the counselor had actually listened to her actively. Now she feels good that somebody had listened to her. I really have no idea what I should do. Today I feel like it's better to hurt myself and die. Then you. Is there anyone with you now? Because she had talked about death and dying. So you have to ascertain now who is there with her. Can I speak to any of your family members? Your family is your only support. Never think that your problems are any less than yours. If you tell them, they will certainly understand and you will get their help and support. Talk to someone around and never think of dying for a matter which could be resolved later. Now it is not a right time to decide about anything, as each and every person is stressed. All decisions taken in stress will appear to be not correct. So give your boyfriend some time to think and don't jump into any conclusion. You can talk to him once the lockdown is over. Don't let any negative thoughts come to your mind. You have accomplished so much till date, so think about what you have rather than what you do not have. Think about what you have rather what you do not have. That is positive assertion. The lockdown is temporary, so we are trying to mend her style of thinking. So never take any permanent steps for a very temporary problem. and it is for your own safety. So think about it as a positive rather than magnifying or making the issue big. Now we are trying to understand how to change her thinking process by this statement. This is called reassurance, advice giving, cognitively structuring her negative thoughts to positive ones, and increasing the support from the family in her life, as it is quite a lonely time, and without her boyfriend to fall back, she would feel miserable to overcome the crisis. This is how you have to deal with her. Caller, do you want to talk to my mother and tell her about it, as I'm very fearful and worried to give her more stress? You, certainly, please put her over the phone. Then you ask her mother whether she knows that her daughter is distressed and that she needs help, inquire whether she had any physical or psychiatric illness previously, refer to the format that I had given already in previous sessions. Then please try to build up their bond and ask her to empathize with the daughter and address her issues with a positive mindset. The counselor also tells her mother to keep her in 24/7 surveillance, and if she continues crying or negative talk, then to take her to a psychiatrist immediately or emergency hospitalization. This should be addressed as an emergency client, but she had herself sought for the counselor's help in telling her mother, so there was some hope of she recovering with support, but still to keep her in vigilance, it was necessary. This is called supportive work and brief cognitive therapy, as her errors of magnification of negatives and minimization of positives were told to her and active guidance was given to her. You, please write down your worry thoughts in a diary from today and see which are the ones which are under your control and which are not under your control, and help yourself to solve the ones which are under your control, like distracting to some activities, doing yoga, meditation, some joint activities with your parents. If you have any other issues, never hesitate to call me again or any of our helpline numbers. This is how you have to go over in the case number 1. Case number 2. This is another distress call. Caller, I am Mr. Raj speaking. Is it the helpline? I feel like I'm having the disease COVID-19, as in my place there are 2 people who are found to be positive. This is one of my cases. These are 2 cases which has come to me and I had to handle them in different ways. I have kept myself in quarantine and have not met my family from last 25 days. I am feeling lost and lonely. What should I do to know whether I have got COVID-19? You, thanks for calling. I am Dr. Maithili Hazarika from the Health and Family Welfare Government of Assam. Where are you calling up from? What is your age, education? What is your occupation? Are you single or married? Do you suffer from any kind of physical illness like cough, fever, nose blockage, respiratory infection, diabetes, hypertension, etc.? The above mentioned inquiries are required to know about his physical status to give him psychoeducation about COVID, because he feels that he has got COVID-19, so we have to know about his background information. You, did you ever feel this distressed in your life? That time, what did you do? How did you try to address your problems? And did you ever go to any psychiatric help for your issues? This is to inquire whether he has any psychiatric illnesses and how did he cope up with his distress before COVID-19. The caller says, yes, I had been to a psychiatrist when I was giving my 12th exam, as I could not focus my mind, and my mind was racing with negative thoughts about exams. But after some counseling sessions, together with anti-anxiolytics, that is some medicines for anxiety, I became all right. I never had such a problem, but I'm a little anxious person. He also mentions that he had anxiety attacks during 12th exam, but now he did not have for quite some time, but also says that he is a very anxious person. That is, his personality itself is anxiety-prone personality. You. That is the reason you are feeling so fearful of something which has not happened to you, because you are an anxious person. And certain things will not happen to you if you maintain social distancing and hygiene. But do you know what is COVID-19? Yes, he says, but not in details. Then the counselor, you. It is coronavirus disease 2019, that is known as COVID-19. It is caused by severe acute respiratory syndrome coronavirus 2. The average incubation for this is from 5 to 6 days, ranging from 0 to 14 days. Currently, there is no specific treatment or vaccine for this, and the symptoms are fever, dry cough, fatigue, sputum production, shortness of breath, sore throat, headache, abnormalities on chest x-ray, and there should be some findings in radiology, that is on the chest CT scan in 86% of the cases. These are the different percentages that I had given. Probably you have to tell him all the percentages also of people having different kind of symptoms. It's mostly transmitted by droplets and contact transmission. It may be airborne or transmitted by fecal-oral too, but research is still going on about its transmission process. And do you know when you can suspect that you have this disease? He may say yes or he may say no. Even if he says no or yes, you still have to give the information. All symptomatic individuals who have undertaken international travel in the last 14 days more so, or national travels, who are symptomatic contacts of laboratory confirmed cases, all symptomatic healthcare personnel, all hospitalized patients with severe acute respiratory illness, or asymptomatic direct and high risk contacts of a confirmed case. Symptomatic refers to what? It refers to having fever, cough, shortness of breath. So all these people who are having a direct and high risk contacts with people who are COVID-19 positive are to be kept in quarantine or should isolate. Besides these people, the others should not keep themselves isolated. You have isolated, this person has isolated himself for more than 25 days, which was not required. Do you have any of these signs and symptoms? You need to ask him. Or have you got a history of being close to the persons who are positive? Caller says, no, I have not known them and they are far away from my home. But still they are from the same place and I have got nose bleeding and fever sometimes. These are not valid grounds to suspect that you have got COVID-19, but still just keep a watch on your immune system. So have balanced diet, sleep well, do physical exercise like walking, jogging on spot, or some yoga. I'll show some videos in next presentations of stress management. Then all the counselors can give that kind of a video and also practice on yourself and also show the video in some ways to the people who wants to learn yoga. From a video, I can show you now what kind of a yoga you could practice. But please distract yourself from such panic thoughts because your symptoms doesn't suggest that you have COVID-19. Be with your family members and there is no need to self-quarantine yourself. Only the people I mentioned who are suspects should quarantine themselves from others. Mingle with family and do some joint activities. Deep breathing exercise can be practiced as he is generally an anxious person and that will keep you calm and relaxed. Could you understand what I have just explained? Can you repeat it for me to know whether you have heard it or not? And what should you think and do now? You have to inquire. And if he had understood what you said, then tell him that his concerns are normal as everyone is feeling stress due to this disease and is unknown because it is unpredictable transmission process and he did the right thing by keeping himself away. But now that it is no more required and as he had already kept himself for 25 days in quarantine, which is required for only 14 days, he can very well mingle with his family members now. Then he was asked whether he was satisfied with the information and kept down the phone with further help can be given if he wants for any other reason. Here, active listening, psychoeducation was given about COVID-19, reassurance that all will be fine was told to him, myths were removed with facts, introduction of new tasks was made, social support to enhance his family was made, and that family time is important to stay mentally fit was reinforced by this method of counseling. So these are the different methods which you have to follow and also collect a format. This is a format which I've already explained in one of my webinar series. You need to go through them and then put the information in this method, in this format for any kind of counseling that you do. I hope I could make you understand how you have to go through each and every step in counseling, 2 distress calls that I have explained in detail. All the best, and I hope in unison we do a good work together. The teamwork will support each other and we will be able to address the mental issues of these people who are in distress for sure.
Hello friends, welcome to the webinar on stress among healthcare workers during COVID-19 pandemic. We all know that the health professionals are more stressed during this time, but why? because they are at risk for infection. They have a lot of psychological distress due to change in the work habits. Suddenly, there is a lot of unpredictability in their routine. There's a lack of communication and feedback also from the supervisors, from the other co-workers, and that can result to a lot of confusion and helplessness. Doctors, sisters, including paramedics and ambulance personnel, display heightened stress. They may become emotionally affected, panicky, traumatized, and are vulnerable for depression and anxiety. This is expected as the anxiety and fear of getting infected is getting higher day by day with the risk of exposure. There may be also fear of transmission to the loved ones and children. The balance between the professional duty, altruism, and personal care for oneself and others can cause a lot of conflict and dissonance in many healthcare providers. They are more vulnerable to develop post-traumatic stress disorder as they are directly exposed to loss of so many lives. What are the chances of health workers getting infected during COVID-19? There's a high chance and a high probability to get the infection. But what are the chances of dying? We have to check the statistics and be informed about it. According to statistics, the range of mortality is quite low. That is from 20 years to around 50 years. It is ranging from 0.2% to 1.3%, which is not too much compared to other diseases. So we have to make ourselves aware of the fact that we may get the infection, but death may not be so sure. There are certain journals that are published in Lancet. It is published about the mental health care of healthcare professionals. They have given important issues about non-availability of the personal protective equipment, stigmatized from the society. Physical and mental exhaustion is very high in these people. There could be reduced social support and isolation from loved ones, and managing uncooperative patients are very, very important issues to address by the healthcare professionals. There could be warning signs of excessive stress in them, like the somatic symptoms like headache, backache, body ache. There could be anxiety, panic attacks. They could feel isolated, withdrawal, and they can take a lot of substances. They may have disorientation in judgment. They could have difficulty in memory and thinking capacity. Then they have to really do something about it, because healthcare professional has to be healthy to deal with the crisis at this point of time. They should not have any insomnia, their appetite should not be disturbed, and there should not be any altered bowel and bladder habits. And if they are so, they have to take help, because there are a lot of depressive symptoms. It is seen in a journal, that is a survey being done and published in just 2020 right now. And it is about, from China, it is about 50% and 45% having depression, anxiety, sleep disturbances, 34%. And healthcare professionals are really distressed. That is 72% of them are distressed. So we definitely have to take care of our mental health. So vicarious traumatization in a general public members and non-members of medical teams. Here we see people who had voluntarily accepted work or have proper knowledge of the illness, and they are prepared psychologically, then their stress levels are less compared to others. So the death rate, as I have already spoken, is very less. And the availability of decision makers. This is another study where if there is clear protocol and guidelines, if the training of the staff is good enough in dealing with mental health issues of the patients, if they are isolated well in a resting place, and there is availability of protective equipment and leisure activities there, contacting family members is there, and people are recognizing their best performance and giving a positive appraisal, then they have a fairer, lesser chance of having stress and other diseases. So predominant concerns of health is about all these, like sometimes they have these kind of concerns that will the people get rapid testing if infected? What about the support for their family from the institute where they are working? Will they get, the family will get support or not if they are ill or if they die? So all those issues are creating a lot of hurdles. This is again published in JAMA in 2020 and 7th of April. So people, the health workers, need to go through all these journals that I have presented here, read about them, be more aware of what is happening to your own issues in different kind of countries, that they are dealing with COVID-19 during this time. In the community level, there is a lot of stigma that this should be avoided against healthcare professionals. So there should be some investment in public healthcare system, insurance policies. You have to follow the advice of the healthcare personnel, make all efforts to prevent violence. There should be laws to deal with violent issues towards healthcare professionals from the community, and priority access to day-to-day general essentials should be given. Insurance for the healthcare staff is very important, and also in order to stop the black market selling of personal protective equipment like masks and different kind of medicines should be checked. In the hospital level, there should be proactive and forward-thinking leadership. Adequate security personnel should be there. Training of the staff. Protocol should be in place. The staff should be informed about the plans and encourage debriefing with the teams, and some kind of virtual debriefing or over the telephone debriefing, awarding the best worker from each team every day if it is possible, and accommodation and basic facilities should be provided in the premises for the healthcare professionals. In the individual level, if I have mentioned about the signs and symptoms, if they are present, then you have to monitor for self-food, hydration, sleep, rest, maintaining your routine or schedule, training yourself up well with updated knowledge about the situation. Contact with family members needs to be reestablished again and again. Be aware of the protocols and the guidelines of your institute. Meeting and discussing and debriefing about your own issues with your colleagues is very important for the healthcare workers. Accepting the loss of a patient and trying to accept and not dwell upon it is very, very important. Leisure time is important. Do some kind of relaxation and yoga and meditation for spiritual well-being. So this is very important for the healthcare professionals to undergo non-stressful situations in life, because this is a time where you have to be prepared from both mental health issues and physical health issues. So you have to be away from all these different kind of stressful situations cognitively and prepare yourself to deal with the crisis with a healthy mind and a healthy body. Thank you.
I'm very delighted to announce that we have come to the end of the web series. These are the tutorials which are made on the basis of the guidelines that we had prepared for the tele-counselors who have come forward to help us in this Assam Mental Health Task Force to do tele-psychological counseling for the quarantine people, the people who are in isolation, the people who are in self-quarantine, and anybody in distress. So these guidelines are of 21 modules, video modules we have created in these last 2 days, and it is all about basic guidelines, how and what about psychological counseling, and what are the ethical standards. And the guidelines also has the counselor's anxiety, how to deal with that, how to deal with different kind of distress, and with other modules like stress management, anger management, substance abuse, domestic violence, disabilities, and so on and so forth. There are 21 video modules that we had created in these last 2 days with hard work and persistence by a team of great people like 2 students who had volunteered from Tata Institute of Social Sciences, Gaurav Borthakur and Daisy Saikia. I appreciate both of them for their effort and for their enthusiasm, and also the director Kalpana Sarthi for allowing them to come to us and help us in this crisis. Secondly, I would appreciate Hemonto Kakuti with his supporting team for helping us with the logistics and supporting us in different ways. I would like to appreciate Prem Singh. He is the web designer who had come forward to help us in designing the modules. My sincere thanks goes to Debujit Fukon and Upasana Bhuya. They are the coordinators of the Finance Department, Government of Assam, and without their help, this would not have been possible. Thank you very much. My support, Dr. Shamonda Das, Assistant Professor of Psychiatry from Guwahati Medical College, Dr. Bornali Das, Psychiatric Social Worker, Senior Lecturer from Guwahati Medical College, has been very supportive in this entire mission for our far-sighted vision to do something for the people who are in crisis. Finally, without the help of the Health and Family Welfare Department, Government of Assam, this would not have been possible. I appreciate their sincere initiative to make it a success, to help all the people who are in distress in this crisis of COVID-19 pandemic. Thank you once again. Thank you once again. Thank you very much.